Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Chiropractic, Posture, and Wellness Clinic. This video has to do with excess kyphosis, too much of a slouch, bad posture. So stay tuned. All right, let's talk about upper part of your body and too much kyphosis or slouching like that. A lot of times people think in order to fix that, you just do that and push your chest out. That is so wrong. It's not even funny. You have to understand. Please pay close attention. Our goal is not to move ourselves from one pose to another. Our goal is to get to that better pose using the right muscles. If you use whatever it takes to get there, you're not owning it. It does not belong to you. You're gonna keep failing. Why would you wanna fail in something that you're putting so much effort in? Just do it correctly from the get-go. How do you do it correctly? You don't rush it. You slow down and you actually feel the muscles that are doing the move. The muscles that will help you go from this to here are not just in your mid back. So you want to do a tuck under. I've done a whole video on that. We're going to make sure that it goes in there. You're going to do a tuck under just because it gets you closer to, gets these muscles closer to where they need to be in order to have a full capability of doing their job. So you're going to tuck under a little bit, which automatically will position your head in a better place. And to bring yourself from here to back here is not a function of your front of your body muscles. That's the mistake. You want to activate these muscles. So look at my profile here. If I'm using the front, I'm basically tightening the muscles here and the muscles in my arm to basically shove this joint backward. So I'm not even using the muscles that are connected to here in the right area to do the job. I'm getting the job done, but the wrong muscles are doing it. I'm going to get tired and fall forward. So if that's happening, I'm going to have to, and I'm going to get a little bit closer, and I'm going to show you how these muscles here will gently pull backward. I'm going to show you the side view. These muscles are gently pulling backward. The front, those muscles are gently pulling backwards. So as you're gently pulling backwards, the muscles in the front are not on vacation. It's just like a bookend. All the contents are in between. If one end is going, it's not going to drag everything here, all the books in between. This part of the book end needs to go with it. So the function of the front area is to support what's initiated back here. You have to understand that. So don't just go crazy, try to move, to make these all crazy moves, fast moves. Don't. The intelligence behind this movement is when you do it slowly, so the brain actually sees the track that it once created correctly, but had to remodify based on what you had been doing and asking it to do. It's not like you sat down and had a conversation with your brain, but through actions, you communicated that to you. You created a requirement for the modification of movement. And all of that is a whole different subject of postural neurology. So if your brain is constantly or your body is constantly in this position, the part of the brain that communicates to your body to be upright against gravity is not going to be practiced. So it starts shrinking. That's a definition of dementia. It's not just cognition. It has to do, dementia is just a shrinkage of the brain. So it can be due to different things and for different actions and different components of living. So pay close attention to that and just do the right thing. If you have a history of chronic pain, if you have a history of chronic tension, if you have a history of re-injuring yourself, what's being missed is not physical therapy or chiropractic or medicine. It's postural neurology and functional movement. Make sure you check out my website. This is not to tell you about me. This is all about what you have been missing. So pay close attention. Thanks for watching, and until next time, take care.